Hey guys, thanks for tuning in. Welcome back to our Prehab series. We're excited to be moving along. We started at the foot. We're all the way up to the cervical spine. Now last week we did the thoracic and stability shoulder blade and the scapula. Today we're going to decide to go up the kinetic chain and go to the neck. We could go out to the side and go down to the elbow, but we're going to go up today. So we're going to talk about the cervical spine. Very unique joint. It's designed to have mobility, but also it's designed to help ensure that you have proper posture and stability. So one of the things I always talk about is posture. We talk about sitting posture. We talk about standing posture. What about biking posture? How is your neck when you're cycling? I started having shoulder and neck pain when I first got my triathlon bike because I was in what's called aero position. Aero position just means that you're in a position like this, you're really aerodynamic, your head is tucked. But in driving with traffic on the bike, I would always look over my left shoulder to spot for cars coming up on my rear view, and I would also look this way. So being in that aggressive aero position, I was getting a lot of this posture, okay? That I needed to address. I needed to get a better bike fit, and I needed to do things on my days off to help ensure that I'm strengthening the muscles and lengthening the proper muscles that don't get that same use, and kind of lengthening the overactive muscles from being in a tightened position, okay? I hope that kind of helps paint a visual of about how active and static posture play a role in your overall posture and neck health, okay? The other thing to think about is your sleeping posture. Right now, I hope for the sake of the video that I am sitting in a neutral neck posture, but when you're sleeping, you want to think about how is your neck. Let's say, for instance, that I'm laying on my side. If I'm laying on my pillow, I don't want my pillow to be so high that I'm here, because if this hand is my pillow and I'm laying on my side, look at what's going on. This portion of my neck is stretched. It's being lengthened for 7 hours a night, while this portion of my neck is short. My ears are eating my shoulders. Okay, this is not a healthy posture. These muscles are overactive, and then when I go to get up, I got a crick in my neck. So that's sleeping posture. What would you do? Well, you don't want to be the other way either. You want to find a nice neutral position pillow that supports your head, where your spine is a neutral spine. That means the discs are stacked. They're nice and happy, how they like to be. Okay? We like to live in these perfect worlds. No one's going to sleep completely perfectly on their side. You're going to have some times where you're like this. You're going to have some times where you just feel comfortable like that. That's okay. That's living. There's no such thing as a perfect everything. But have those things in mind for when you start to have this pain. Start making adjustments right away. See what you can do to fix it. The other thing is we talked about with the thoracic spine is forward posture. If you're here, check out this. My neck is not happy. Okay, it doesn't like being like this. I may be like this though because I'm texting or playing a video game or sitting, and this is just what now doctors are calling text neck. If you're texting on your phone, you're doing this all the time. These muscles will form to that posture. They'll actually lock up and they'll actually start to grow and form to this posture. So we have to do things to restore a healthier posture for your neck. Okay? Our neck likes to do a couple motions. It likes to do rotations where we go to the side. In fact, this side rotation is just great mobility work. It likes to do a little bit of extension, it likes to do a little bit of flexion, but it doesn't like to live in any one plane. A little bit of forward here, a little bit of back. You get some weird angles you can do with your neck. So it's a very mobile joint, okay? So today we're going to talk about some mobility exercises you can do, some stretches, and then some easy strengthening exercises you can do. The beautiful thing about the neck is you can do most of these things while you're sitting, driving, while you're at work, or while you're just standing. They're phenomenal. So the first one I want to talk about is a little bit of mobility work. Let's talk about, we just did one of them, rotations. So you just look to the side, keeping shoulders still, 5-second hold, and then you go to the other side. This is ensuring that you get full range of motion through the neck. I cannot tell you how many times I've done a personal training assessment on a client. The first thing I have them do with the neck mobility is look to your right, look to your left. I'll tell them look to the right and they'll go here, and then I'll say go left and they'll go way here. Right away, I start digging in. What's your day like? What do you do day to day? How do you sleep? Because this is going to allow me to design a program based on their needs. So right now, look to the side, 5-second hold, do maybe about 10 of those. Another motion one is you can look up, and you can look down. Those are great mobility exercises. Okay. Since we're talking about establishing motion, I'm also going to grab a couple tools that are going to help you with establishing mobility and flexibility throughout the neck. One of my favorite toys is actually this right here. It's called a TheraCane. I believe Dr. Roth sells these at Williamsburg Neck and Back, and Amazon sells them as well. But if you've never used one of these, pop into Neck and Back and check them out. These things are great, guys. So what you're gonna do, you can also do different muscles. You can do lower back, you can do kind of anything you can get this on. But we're gonna talk about the shoulder and the neck today. So I want you to identify, you can do the occipitals, which are these muscles back through here. You're gonna identify where you feel a tight spot, tight pressure, and you're gonna just kind of press in and work at it and then just hold pressure for about 30 seconds. You can do the upper traps. These muscles are always overactive. So you're gonna just identify where you feel that tight spot, sit and hold. About 30 seconds to a minute. You can even work your way around your back. Hey, all my desk workers, my sitters, this is your magic. This is for you. So you just sit and hold. You can do both sides. You're just kind of poking and prodding, and you're looking for where you feel that sweet spot. Remember, we're not always pain hunting. We're looking for where you feel pressure. You may feel a little pain, but you have to identify, is that tightness or is that true pain? If you press down and you have radiating sensation down the arm, you're gonna wanna let up a little bit. Things you may feel some pulses, you may feel muscles kind of tightening and relaxing, a little bit of spasms there, which is okay. I would spend anywhere from 5 to 10 minutes total on both sides with the Theracane, just to promote blood flow and to loosen things up. Then after that, you're gonna wanna go into your static stretches where you're holding. Some of the great workday stretches, long car trip travel stretches. Let's start with an upper trap stretch. So you're gonna go here, you're gonna lean to the side, gentle pull. Since we're talking about the muscles of the neck, you're gonna wanna hold it anywhere from 15 to 20 seconds. You don't really wanna get into the too long of holds like you would a hamstring stretch where you'd hold for a minute. For the neck, 15, 20 seconds is plenty. So you do about a set here, and then you go to the other side. Pro tips, you don't wanna get into leaning. Sometimes when we have our hand on our head, we want to lean, so to create that mobility, we'll lean our body. Remember, you want shoulders square. We're going to lean from the neck. So you do both sides, a few sets. Next one, we're going to do the smell of the armpit. So we're going to look down at the armpit, hand on top of the head, gentle pull down. And you hold that one. You do both sides. These are good starter stretches. We're going to talk about creating next, cervical rotation. So you take yourself a towel. It's kind of tricky. You're going to go over the shoulders. Okay, we're going to cross grip. So one hand's going to hold. The hand that's holding, we're going to use that opposite hand. We're going to bring it up on the chin. Keeping shoulders still. We're going to rotate towards the bottom hand. Going to go to the side. Keep your shoulders square. You don't want to choke yourself. We're here on the cheek. Hold that 20 seconds and relax. And you can do 3 to 4 of those, even 5. It depends on how much time you have in your day. Okay? You can do it the other way, just switching. Okay. Another great stretch, just pulling down a little bit, looking up, doing a flow, and then back down. Looking up, easy flow. And back down. Another great stretch, there's a muscle. Platysma runs down through the neck there. Find your collarbones. You're going to press in on your collarbones there. Just press, create a little pressure there. Going to look up at an angle. Kind of moving your chin up. I feel that right through there. Good 20-second hold. After 20 seconds, do the other side. It's a great workday stretches, great workday stretches. Now, I don't want to mess up the angles. I don't want to take us for a walk in this video, but another great stretch is your chest stretch. Remember, things on the front of the body are tight, so find a doorway. Let's say the hands are here at the doorway. You're going to put your hands in the doorway jam, step in. You'll feel a stretch through the front of the chest, front of the delts, and you hold that for 30 seconds. That's a chest stretch. But remember, we're never focusing on only one joint. All of these things work together. They work in concert. So we're going to want to make sure that we're getting motion through the chest as well. Guys, that's a great start for neck mobility and stretching. I would say do those on your off day or do those once a day. Whenever I'm really tensed and I start getting headaches and I start feeling these things creep on, I start doing these exercises. They're phenomenal. The next thing we're going to talk about a couple strength training exercises you can do for the neck. First one is chin tucks. This is one of the hardest exercises to coach. So we're going to want to think about, for this chin tuck exercise, keeping our head on the same plane. We're not going to look up, we're not going to look down. We're going to keep our head on the plane. Imagine parallel lines running. Boom. We don't want to intersect those lines. We're going to do what's called a chin protraction, retraction. So you're here, make an L with your hand, put your thumb on your chest right in the center. Chin's going to go there. We're going to pull away from that. So we're not going to look down, we're going to pull back. 5-second hold, and then relax. Do you see what I'm doing to my posture? I'm using the muscles of my neck to pull my head back and relax. You may find that this is actually really hard to do. This is a great exercise to strengthen the muscles responsible for holding your head steady. Okay? We can also do isometric neck contractions. Remember, we're not going to push hard. We're going to put our hand here. You're going to just lean into your hand. 5-second hold and relax. Lean into your hand, 5-second hold and relax. So you can do 5 to 10 on each side. You can go back here and go back. You can go here and go forward. You're just doing things to get these muscles to waken up. Wake up, be active. Let's use you guys. So think about that, guys. On your off days, neck mobility, neck stretching. On your days where you're strengthening, a little bit of isometric strength for the neck goes a long way. But the biggest thing you can do is establish good sleeping posture, sitting posture, and good throughout the day active posture of the neck. If you ever have shoulder pain, radiculopathy where you're having pain, radiculopathy just means radiating pain down the arm or radiating pain down a joint. If you're having pain radiating down the arm, down the joint, you're having neck and jaw pain. If you're having neck and jaw pain, definitely check with a medical professional. Don't just start doing these exercises, but check with the medical professional first. But if you're having tightness and you notice some different sensations, first thing to do is look at what you've changed in your day-to-day life, whether that's a new sleeping, if you're sitting, if you're watching movies, you're reading more. What are you doing? Take actual inventory of what did I do day to day, what could cause this? If it's something structural that you're doing with your body, try to adjust that. Work with a trainer that understands rehab, prehab. Work with a trainer or a physiotherapist that understands how to create a routine individual to you, because what you do day to day and what I do day to day are very different things. Like I said, remember when I started cycling, I started having all this crazy weird neck tightness. It came from cycling. Once I figured that out and changed my posture, it helped. So identify what works for you and how to make a better program, well-rounded for you. I hope this information in the cervical video helped. If you have any questions, please feel free, shoot me an email, info at pesfit.com. Leave us a comment on our YouTube page, my personal Instagram page, power_runner, or on Instagram, pesfitgym. You can send us an email, give us a call. We're here to help. I hope you guys have a great day. Enjoy. I'll see you soon.